I think we are live, Shilpa madam.
Yes, you can start, please. I will give the intro. So this is our new concept of showing things about embryology live by Dr. Jay. So as some of you might know that he started his career as traveling embryologist, and he has immense experience in embryology. And I think being both the clinical reproductive medicine specialist and embryologist gives him an edge over the only embryologist, because I think he understands what the clinicians would really want to know about embryology and what is important and what is not. So over to you, sir. You can start.
Yeah, I think, see, now you can see the screen. My pipette is in the plate picking up the blastocyst embryo. Can you see that?
Yeah.
So I have picked up both the embryos and I'm going to put it in the equilibration solution. All right, see, that's the equilibration solution, as you can see. And once the embryos go in the equilibration solution, okay, 2 blastocyst embryos are there in that. Can you see? See, most important is you just have to ensure that these embryos, they stay in the equilibration solution for around 12 to 13 minutes, okay?
So you are just washing them. What are you doing?
Yeah, see, from the top of the droplet till the bottom of the droplet, okay? You need to ensure that these embryos get washed in this equilibration solution. Okay, they are floating. Okay, these embryos are floating at the surface of the equilibration solution. They need to go till the depth. So see what I have done. If you see, I have washed it 4 to 5 times. And if I magnify it further, you will be able to see that the embryos have begun to shrink. Okay, this embryo has begun to shrink. Can you see this embryo? It has begun to shrink there.
Yeah.
Correct?
Yes.
And it has sunk down. The other embryo is still on the higher ground. Can you see?
Yeah.
One is below, one is above. Can you see? I'm changing the rotation and magnification. Can you see that embryo getting shrunk?
Yes.
Yeah. So that's a very, very important part of vitrification, because it needs to get dehydrated. The embryo basically, just a minute, I will just ensure that the other guy also. The embryo basically needs to get dehydrated completely. Okay. A completely dehydrated embryo is the embryo which is extremely good. So what does equilibration do, or why do we want to do freezing for anybody for that matter? See, remember, can you see these embryos now? You will see that both the embryos have begun the process of getting shrunk. Why is it happening? That is because the isotonicity of the equilibration solution is higher than the isotonicity of the embryo. Correct? So what happens is the fluid would escape the embryo and it would enter inside the equilibration solution, which causes the fluid to shrink, which causes this embryo to shrink. Correct? Now, what is important is most of these solutions, they contain something called as PEG, that is polyethyl glycol, okay, along with a solution of sucrose. Okay, so the fluid inside the cavity, this cavity from inside should be filled up by the cryoprotective solution, because when we dip this in liquid nitrogen, it is going to go from 37 degrees to direct 180 190 degrees negative. So it is going to have a huge drop of temperature. Correct? In order for the cells to survive out of this drop, that means when we want the cells to survive through this drop, what is important is we ensure that this cavity gets replaced by cryoprotectant solution, so that when this embryo is shrunk from inside, okay, it does not have any toxic effects of vitrification. That is the most important thing, which is why this technique of doing it correctly is very, very important. If you see, I washed it in this, I took it from top and below, from the surface to going below, around 3 to 4 times. Okay, this is a very, very important part of it. Allows for this fixation of cryoprotectant to occur inside. Okay. Please remember, we always try to ensure that a blastocyst embryo is going to be first made, and then the blastocyst embryo is going to undergo vitrification, because survival rates for blastocyst vitrification are absolutely fantastic. Okay, these blastocyst embryos, when vitrified and thawed correctly, would give you a survival rate of close to 98 to 99%. Okay, fine. Now, simultaneously, I will just switch the screen till all this is happening, and I will show you how the cryo lock is. Okay, so this is the situation. This is the cryo lock inside which the embryos will be kept. So if you can see, there is a black colored mark at the tip. Okay, and underneath the black colored mark is a well. Okay, so I'm just putting this inside. You can look at the screen now. I'm just putting this inside the microscope so that you can see the well. Okay, so now my device goes inside the microscope, and see, you will be able to see. Can you see a gutter which is present there? Can you see that on the screen? Can you see that gutter-like arrangement which is present? See now, can you see? This is the gutter inside which the embryos will be loaded. Okay, so what it does is it offers for excellent cryoprotection inside the gutter. The embryo do not get lost inside that, and because the embryos do not get lost inside that, it is a very good, very safe device. Obviously, we have multiple techniques of protecting this. This is a closed loop, basically a system where the embryos are going to be protected. You can have open loop systems also. You can do a tagging over these embryos and see if it is the same patient's embryo which has gone inside. All these types of things. Okay, but then again, those are technical discussions which we can probably discuss when we look at that part of the laboratory. Okay, so I will again go back to the embryos. You would have started to now notice that both the embryos are almost about to get shrunk. Can you see that? Can you compare it to your previous images? Then you will know that both the embryos are beginning to get shrunk very nicely. It has been around 6 minutes so far. So we have another 6 minutes to go. So normally what would happen is the embryo which is shrunk more, no, it will recover slightly more. Okay. And when it recovers slightly more, it will have this beautiful sort of an advantage that it is recovering very nicely. Okay. When it recovers very nicely, keep one thing in mind. That is the best embryo to undergo vitrification. Okay, because the difference between equilibration and vitrification, see, currently it is in equilibration solution. Okay, if I see this droplet is equilibration drop, and the droplet underneath that is the vitrification drop. So we have marked it. Can you see this? V is for vitrification, E is for equilibration. Vitrification would have double the concentration of PEG and sucrose. Okay, double the concentration than equilibration. So basically your exposure time to the vitrification is very, very, very less. Your embryo should be exposed to a vitrification solution for less than approximately 80 seconds. If your exposure to the embryo is more than 80 seconds, it can go and cause damage to the trophectoderms. Okay, and that is something which you have to avoid. And as a result of this, cryopreservation of the embryos or vitrification of the embryos is a very, very important part of the technique which people would follow. Okay, I would also like to show you at this moment. This is the thermocol chamber inside which there is liquid nitrogen which has been kept. Okay, can you see this? My finger is dipping inside liquid nitrogen. You can see the vapors coming out. So this is liquid nitrogen which is kept inside that. The straw will be transported inside liquid nitrogen, and from there it is going to go inside the cryo can. Inside the cryo can, everything is labeled. So obviously you have straws which are labeled, and then some people would have a computerized register. Some people would not have a computerized register. They would have a manual register which tells them what is the location of the embryo at, at which part, where is the embryo located for that particular patient. So that is just something which you should know, because it is important from the point of view of keeping the record. This record should also be given to the patient, because the patient should know how many embryos they formed, what is the status of the embryo, and how have they been cryopreserved. So that is also very, very important from the standpoint of the patients to understand. Okay, now you can see this. See, now you will see that the other embryo here, can you see that second embryo? It has begun to expand a little. Okay, it has been around 8.5 minutes, and that embryo has begun to expand. Now, because that embryo is expanding, I'm very, very happy, because that indicates that it is going to form an excellent recovery for this particular embryo. Okay, small points. If you do more of freezing on your own and Once upon a time in my life, I used to do all these things on my own. Today, thanks to Dr. Shilpa, I am back inside the laboratory and doing vitrification one time more. Otherwise, we don't, I mean, I don't do it at least. There is a full team of embryologists to do it. One more important thing, if you see, our our laminar airflow temperature is not present. So that does not mean it is not functional. That just means that we don't need to keep the plate at 37 degrees. Okay, so the plate is connected to the heating block and the heating block is at room temperature. You don't really need to connect it at at 37 degrees. Again, that is a very important point. Many people don't really know that only. Okay, because probably they have not, in their busy schedule of practice, they have not got the time to enter inside the laboratory so frequently. But this is a very common point. You need not really have a heating block for freezing of your embryos. Okay, here are the embryos. You can see now. I think now you can see it much better how the embryos have begun to get expanded. Can you see that, Dr. Shilpa?
Yes, it's beautiful.
Yeah. So this expansion of the embryos is a very, very important thing. So now we are finishing 10 minutes. We just have 2 more minutes. And in the second minute, like after 12 minutes is done, we will take it off. Okay. And we will put them inside the vitrification solution. So I will just give them one more wash just for, my mental happiness. I would just like to give a wash. So I would just a little de-zoom it. So I'm just washing them. Can you see that? I'm just not aspirating and throwing. I'm only washing them around so that whatever little cryoprotectant which has not gone inside would go inside. Okay. We use a standard set of 300 micropipettes for doing this. This is standardly available in your own laboratory by your own embryologist. So there is no need to worry in this. You can see both these embryos have an excellent inner cell mass. Both the embryos have an excellent inner cell mass. These are really beautiful expanded embryos with a thin zona. This is one of the best times, honestly, to assess the zona as well. So if you see very closely, you can see the zona of this embryo. Okay, is so thinned out. Can you see that? This
Yeah.
is such a thinned out zone, right? And this is a very good sign of a good embryo. See, sometimes people also what they do is they put a laser over the cavity, okay, and they empty the embryo. So what they want to do is they want to ensure that the embryos get shrunk and then they vitrify it. That is also a good technique. See, what happens in that is you are not running the risk of the cryoprotectant damaging the fluid inside. The fluid is left out. Okay, so you don't run that risk, but we don't do it because we have got excellent results. Uh, we've got excellent results with this over a prolonged period of time. So we've not been doing it. I'll just de-zoom it out a little because now time has come in the next 25-30 seconds or so that I will have to take it off and go inside the vitrification. So I'm just emptying out the vitrification a little and I will be lifting off the embryos. That this procedure, this part of the procedure is going to happen little fast because we have a minute. So what will happen is, see, I've just unzoomed it, and once I unzoom it, I'll be coming inside in a little while. Guys, as clinicians, we have a team of embryologists to do all these things, but I personally think if you are good at doing these type of things on your own, okay, then I think it makes a difference. Okay, this is just my thoughts, just my suggestion, but even honestly, I also don't do it so much these days. Okay, so here we go. I'm coming inside. You can see my embryos are aspirated. I've gone in the vitrification and the timer for 1 minute would have begun by now. This is just 1 minute. I would like to rinse the embryos 4-5 times here. So I would just zoom in and show just for academic purposes for everyone to understand. See, if I have zoomed in, can you see how the embryos have got crumpled there? Can you see that?
Yes.
Yeah, this crumpling of the embryo is very, very important. Very, very, very important. Okay, only if the embryos get crumpled so nicely, that means they will have an excellent cryoprotection. Okay, I'm about to finish and I have around 15 to 20 seconds more to go. So I will again zoom it out. And so the time has come, and let my straw come inside. So you will be able to see the straw. I think you should be able to see the straw. Probably no. Probably no. Wait. Just trying to make sure that all of you see the straw. I think now you can see the straw. So embryos have been taken out and they are getting loaded, both of them getting pushed, and excess fluid taken out. Can you see that? Once the excess fluid is taken out, immediately within a second it will get dipped, and we will just lock this embryo. So the canister gets locked and it will be put back inside the freezing chamber. All right. So that's this entire process of vitrification, and I'm happy we did this after a very long time. And of course, if there are 2 or 3 questions, I can answer. Otherwise, this is more like a surgical demonstration, to be honest.
Yeah, I'll just ask a few questions, which may be in many clinicians' mind. So, why is it that, like, oocyte freezing is more tough than
Number of
embryo
cells is less,
freezing?
madam.
What?
Oocyte is a single cell, and oocyte is a single cell which is arrested at meiosis. So if your freezing technique is wrong, the oocyte, when it comes out, that oocyte is going to simply not survive. It will die. Embryo, on the contrary, blastocyst embryo, on the contrary, has more than 100 cells.
And so there are various media, the vitrification kits which are available commercially.
I am using the one from Kitazato.
Okay. And is there any difference in terms of these commercially available kits, or one is equally good to another, and whatever you are comfortable, you can use it?
All politicians are politicians, madam. So no need to worry. All the kits are good.
Okay. So do you follow a particular vitrification method? I mean, does it change with regard to the blastocyst, or with regard to the 8-cell?
No. Almost the same.
So you don't tweak anything like the number of, do you keep checking like how you showed that how it got crumpled? I mean, do you keep checking in that ES?
Once or twice we'll check in the ES. That is a rule, because that is a very important part that the solution is acting.
Okay. And you did it wonderfully well, even though you don't do it on a routine basis.
I'm
So
doing it
is
after a
it like,
year.
some
Can you
skill
imagine?
which, wow. So is it some skill that you need to keep like, practicing so that you are like used to doing it, or is it a one time like
You
cycling
should be
where
good
you
at
know it and
handling
you
the
do it for
gametes
lifetime?
using the micropipettes. One has to be good at handling the gametes with the micropipette. If somebody is good, then they can do it very nicely.
Okay. And in your setup, what is the rate of recovery once you do vitrification? I mean, is it
More than
99%?
98-99%.
Okay. And what in this technique that you say, what is one rate limiting step which says that, like, is it the time, is it the media, is it the size of the cell?
Vitrification exposure. No, the vitrification exposure time should be less than 80 seconds. That is very important.
Oh, okay. And so the permeability of the membrane of the blastocyst, you think, I mean, you said the zona which was thin in one of the embryos. So in those situations, the thinner zona will have more permeability and better chances of like recovery and freezing,
No,
or it?
no, nothing like that.
Okay. And in your practice, do you routinely do that, extracting the fluid inside the blastocyst
Not at
and
all.
then?
We don't do it at all, madam. We don't do it at all.
Okay. And do you kind of keep changing your media? Like now you're using Kitazato, so every year you keep changing, or
No. We have been using Kitazato since 6-7 years. We have not changed.
okay. And yeah, I mean, is there, so it is like a kit, right? I mean, where you get the buffer solution, the ES and the VS. So is it just one kit which comes in? or it is like you have to buy multiples of these, like only ES solution you order separately, VS.
This is the kit.
Yeah.
Okay.
And uh,
Can you see
and
this?
yeah. So for how many cases does this come? Like
We would be using it for more than 40, 50 straws. That is because we do more than 40 embryos at one time. So we make 40 such small drops and finish around 15, 20 patients in 1 hour, less than 1 hour. So
okay.
that's very economical for us, but then it's okay.
Hmm. So in this situation, the Kitasato media, that kit you showed now, has it got a very short expiry or
2 years, I think. The expiry is 2 years, probably. But I'll show you again. See.
hmm. So is it because like you are comfortable with this, like you have been happy with this, so that is why you have stuck to this for so many years?
Yeah, I mean, it's a great kit, madam. I mean, it's never given us a problem. So, of course,
Okay.
all kits are good. Let me first tell that to you that there is no problem in quite a lot of these kits. They are very good because they are all standardized, madam.
Okay. So do you do an audit? Like, is there a time when the recovery of these embryos have not been good, and have you done an audit to check where the problem was in any of your cycles?
Only if something goes wrong, madam, not otherwise.
Okay, and warming, I think we should take it up another this thing. So warming or thawing, will it be like very much connected to the vitrification procedure?
Yeah, thawing time is 1 minute, then dilution solution is 3 to 4 minutes, and washing solution is another 4 to 6 minutes, and then from there you take it in a fresh media and you incubate it for 2 hours, maybe 3 hours prior to do the transfer.
Okay, so if you do 10 cases of vitrification for embryos, how many oocyte vitrification do you usually do? Is it like for social egg freezing or for
Last 1 year it has been crazy. I mean, a lot of girls have come for social egg freezing in the last 1 year, but
mm-hmm.
but yeah, it's okay.
But it's the same technique, is it? I mean, what
Same.
you okay.
But the only difference is we need to denude the oocyte, and the oocyte exposure time is little less, madam. 10 minutes, 9 minutes, something like that.
But that is a little more challenging than the embryo freezing, right? Because
Little more.
yeah. Okay. Yeah, that was good. I think, and the amount of media that you take, I mean, that does that
15
have,
microliter.
yeah, 50. So that is equally important to be noted. You don't want excess. You don't want lesser media to be taken into this thing. Yeah.
I
So
agree.
thank you. I mean, it was wonderful to watch all this, even though, like, I mean, we don't really do it by ourselves, but I think this is something which every clinician should be aware of, who can get used to, like, seeing these things, and they can get involved in the embryology work. Thank you so much. Thank you for your